with you in just a second, my lovely. I'm just going to get a few things out of my kit bag, okay? There we go. Right then, let me just grab my book and I'll take a look at what has been going on with you according to the surgery notes. Okay, alright, so I can tell you're feeling very poorly. So you've been having some dizziness? Okay. Is that when you sit still or when you move? Mainly when you move, okay. Any nausea with that? Okay. Is it a proper spinning sensation? Yeah. Or like flickering? Yeah, okay. Okay. So have you had a cold or anything like that recently? Alright, about 10 days ago you started with a heavy cold. Okay. So, usual symptoms. Did you have a sore throat then? Yeah, okay. Lots of sinus congestion. Alright. Do you have any pain across your face at the moment in the sinus area? You do, okay. And a general headache? Alright, okay. Okay. See what else, if there's anything else that came across. Oh yes, there's a note here to say that you've had a bit of a cough as well. Okay. Right then. Have you been having a temperature? Right. Do you know what that temperature was? Okay, so it was 38.2. Alright. But sometimes you're still feeling a little hot. Okay. And body aches as well. Alright. Are they still with you? No, okay, they've subsided a lot. Alright. Okay. You got any ear pain? Okay. Let's have a look. Okay, have you been taking any medication? Painkillers, okay, like paracetamol? Yeah, okay, that's great. Alright. And anything else? Okay, a nasal decongestant. Alright. How long have you been using that for? Okay, right, well I need you to stop using that now. If you tend to use those things for longer than 5 to 7 days, you get rebound congestion, and that can actually be worse than the original congestion. Okay, and you've been using that for about 9 days, so that won't be helping at all with your pain and the congestion in your face. So please stop using that. Which one were you using? Oh, okay, yeah, stop using that now. Okay, paracetamol is fine. Just having a quick look. Other meds. Do you take other medications? No. So you're okay with ibuprofen, but I will check your blood pressure anyway. Okay, because it's important that you've got low blood pressure, low or normal blood pressure if you're going to take ibuprofen or any of those anti-inflammatory meds. Okay, but we need to see what's going on with you first, don't we, my lovely? So I'll give you a nice examination. So you just relax there and I'll just get some gloves on. Okay. Are you able to eat and drink at the moment? Okay, so you've been drinking plenty of fluids, water, tea, juice, brilliant, okay. But your appetite's not been great with the dizziness, okay, nausea. Do you eat anything at all? Okay, that's fine. It's more important that you keep drinking, okay. Yeah, if you're keeping the fluids going in, food is not quite so important. Okay, have you had any abdominal pain at all? No, no other symptoms. Okay, but your chest still feels a little bit uncomfortable. Alright, well, we'll have a good check of all that in a second. Alright then. So firstly, I'm just going to pop this thermometer into your ear, my lovely. Alright, and just check your temperature. Keep nice and still for me, okay? There we go, let's pop that in there. You'll some beeps. Okay. Right. Yeah, your temperature's a little bit up. It's 37.9, so you do have a bit of a fever still going on there. Okay. Right. Now, I'm just going to have a feel of your lymph nodes, if I may. So you just relax there, okay? Tell me if anything feels a little bit sore or uncomfortable. All right. Okay. Just go down your neck first, okay? Okay, just underneath your chin. Okay, just behind the ears. Okay. Behind your head a little bit. Okay. And just across your collarbone. Okay. Is anything uncomfortable, my lovely? Now, while you've got a loose garment on, may I just check the lymph nodes underneath your armpits? Okay, it might be a little bit ticklish. Alright, so I'll just hold your arm up here, okay, and I'll just have a little press around. Let your arm go floppy and I'll move it. Alright, there we go. Well done. Okay, let's just have a little feel of those lymph nodes. There's a few sets of lymph nodes under the armpit there. Okay, just relax that arm for me. Let's have a look at this side. Right. Let me just take your arm there, okay. Is that alright for you? Okay. Alright. Okay, was that sore? No? Okay. You've got a few little lymph nodes swollen around your neck area there, which is quite indicative of an infection. Yeah. Okay. Let's make a little note there. Okay. So I'm going to take your blood pressure. I know this can feel a little bit tight and uncomfortable, but I need to just check that, right? Particularly with you being dizzy. So I'm just going to pop the cuff around your arm. I need to use my stethoscope at the same time, so I'll just pop that in. Okay. Alright. Okay. So I'll just pop this around your arm. Okay. There we go. And I'm just going to inflate the cuff here. Alright. It will go tight. Alright. Okay. Let's put my stethoscope there. Here we go. Alright. healthy. Let's try it on this side. I always like to do both sides for comparison. Okay, let's pop that on there for you. Alright. Get the stethoscope underneath. There we go. And let's pump that up. Okay, that's the same on both sides, so that's really good. Alright, let's get that off you now. Not the most comfortable thing. Okay, there we go. Right. I'll just pop that back into my little bag. And while I've got my stethoscope in, I'll have a listen to your chest, okay? Okay, there we go. So I'm just going to place this onto your chest. I'd like you just to take a nice deep breath in and out, okay? In and out. Okay, and again for me. Okay, and again, in and out. Perfect. Just going to go around the back a little bit there. Okay. In and out. And again. Okay. Just going to pop around the back this side. In and out. And again. Okay, now I'd just like you to breathe normally for me for a second. Okay, just listen to your heart there. Okay, just going to place this onto your neck. Alright. Just breathe normally. Okay. And could you give me a little cough when I pop my stethoscope onto your chest? Okay? Alright. Nice cough. Okay, and again. Again. Okay. Just breathe normally now. Okay, that's fine. Just relax. Okay. Right. You do have a little bit of rubbish in your chest there, a little bit of a wheeze as well. Okay, so you've probably got a little bit of a chest infection going on. Okay. Right. But your heart rate is fine. It sounds healthy too, so that's a bonus. Okay. Next I'm going to check your ears. Alright. Okay. Okay then. So, I'm going to check your ears using this, an otoscope, okay? And I'll just gently insert that into your ear canal and have a little look around to see what's going on there. Alright, okay. Keep nice and still for me. Okay, I'm just going to gently insert the otoscope now. Just pull up and back on your ear. There we go. And just gently insert that. Perfect. Okay. So your ear canal looks a little red, but I can see that you've got fluid behind your tympanic membrane, your eardrum, and it looks a little bit infected, okay? It's not clear, it looks a little bit yellowy, and there are some bubbles as well, and the eardrum is bulging slightly, so there is an infection there. in the middle ear. Okay, this is probably a little uncomfortable. Are you okay? Wonderful. Just a little reposition. I'll be as quick as I can, my lovely. Alright. Okay, I'm going to gently withdraw that now. Okay, there we go. Right, I'm going to have a look in your right ear now. Okay, keep nice and still again for me, thank you. Alright then, let's see what's going on here. I'm guessing this might be similar to the other ear. So I'm just going to gently pull up and back and insert that now. Okay. A little red in there again. And again, slightly purulent looking fluid behind the eardrum. Some bubbles. I can't see the structures behind there, so there's definitely an infection in there. Just reposition that a little bit. Alright. I won't leave that in there any longer because that's going to be uncomfortable. Okay, there we go. That's all done. Just change the tip and I'll take a little look at your nose, okay? Alright. So, keep nice and still for me. I'll just pop this up your nose, okay? Very gently, just lift up the end, okay? Alright. There we go. Okay. Oh yes, that's not very pleasant up there, is it? No. Okay. Have a look up this side. Alright. I'm going to just have a little press around your face. Tell me where it hurts the most, okay? So this is just up on the forehead. Okay. Okay. Sore? Yeah. Just going to press just up there. Alright, top of your nose. Just press, press, press. That's all. Okay. And just along here, the maxillary sinus. Okay. So, just going to press, 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 press. Oh, is that sore? Okay, I thought it might be. Okay, won't do any more of that. You are very, very congested, I can tell. Yeah. Okay. I'm just going to have a little press around your ears. Tell me if this is painful. Alright. Yeah. Yeah. Okay. Little tug on the ear. Alright, okay. Alright, that's kind of proving you've got an infection as well when it's very uncomfortable to touch, and if I do a gentle tug. Yeah, okay. Little press around. Right, yeah, that's all too. Okay. A little tug there. Alright, okay. I won't cause you any more discomfort. Okay. So I'm going to take a little look inside your mouth and throat. Is that all right? Okay. Let's get a nice fresh tongue present. Okay. Right, I'm just going to shine my light into the back of your throat. Okay. I need you to open as wide as you can, okay? It might be very uncomfortable, and I'll be as quick as possible for you, my lovely. Alright, just pop that onto the tongue. There we go, well done. And I'm just going to look in there, okay? Say R for me. Alright, it does look a little bit inflamed in there, even though it's not feeling that sore anymore. Okay, just have a little bit of a look around. I'm just going to move your cheek with this now. Okay, alright. Just look there. Alright, on this side. Okay. Could you just pop the tongue to the roof of your mouth for me? Thank you. Alright. And could you just stick your tongue out again? Okay, that's fine. Alright. Now, I just want to do some little head movements. Now, I'll apologise in advance if this triggers the spinning sensation, okay? But could you just put your head back a little bit? Okay, does that make you feel like it's going to start spinning? Alright, okay. Could you just pop it to the side and back, to the side and back? Okay, how was that? A little bit woozy, alright. And to the side and back, to the side and back. And could you just pop your head forward for me? Okay, and pop your head up. Okay. Could you just move it like that quite quickly to the side? Okay, so that makes you feel dizzy, okay, and that as well. Alright, okay. You do have a little bit of what we call Nystagmus, where the eyes jerk a little bit with the dizziness, okay. Now that can be present in a few conditions, inner ear problems, where you get little crystals called otoliths that actually form in your ear, and they move and dislodge. So the normal signals from your brain in your ear, okay, they get a little bit mixed up, so it really affects your balance, hence it causes that spinning sensation. Okay, that's one problem that you could have. Vertigo, okay, BPPV. There's acute labyrinthitis, okay, I can never say that word, and I'm a doctor. Acute labyrinthitis, and that can give similar symptoms as well. But I actually think what's going on here is more to do with a middle ear infection because of all this horrible congestion that you've got. Yeah. Now, when you've been blowing your nose or sneezing, I know it's not very nice to talk about, but what colour of discharge is coming out of your nose and mucus? Okay, so it's been greeny but with blood and sometimes a little bit browny coloured. Okay, now sometimes green doesn't necessarily mean there's an infection, but in this case I'm pretty sure you've got sinusitis, okay, which is a follow-on from the cold that you had. You've been using those decongestants, but I think the infection has spread into your ears and a little bit onto your chest. Okay, yeah, so are you keeping the room well ventilated? That's good. Okay, have you tried steaming over a bowl? Put a towel over your head in a bowl of water. You can put a few little old bass oil drops or something like that. That can help ease the congestion. Okay, that's quite comforting. But what I am going to do, I'm going to prescribe you an antibiotic, okay, which hopefully you can get someone to get that for you straight away. Okay, yeah, alright, that's fine. We'll get you on that straight away. I'm going to prescribe you amoxicillin, okay. You've got no allergies to medications that I'm aware of, is that right? Okay, so I'm going to give you 500 milligrams 3 times a day. Okay, it's quite a high dose, but we need to tackle this infection, alright. And I want you to keep drinking plenty of fluids as well, alright. I'm also going to give you another tablet, okay. It's called Bucostem, and it's just something that you pop under your lip there against your gum, and it dissolves, and that actually really helps with the dizziness and nausea, okay, which I would hope would subside anyway once the infection starts to clear and you can drain. But because it's becoming very problematic and you said it's getting worse, I'd rather give you something to make you more comfortable until the antibiotics kick in, if that's okay. Alright, but do keep drinking those fluids. So let me just make a note of the script here. Okay. I'll pop out to my car. I'll get my pad from there, and then I'll pop back and hand your friend the prescription, right? And they can go and get that for you. Okay. If you start to feel worse in any way, or you think you're having side effects from the medication, please just call the surgery and I'll come back out to you. Don't worry, you haven't got to come down to the surgery. I'll make sure I come out here to your home and take good care of you. All right. So start the meds as soon as you've got them. All right. Stay relaxed. Don't do anything. Lots of rest. Okay. Sleep propped up. I guess that's what you've been doing anyway. Yeah. So prop yourself up into a nice comfy position where your head is so comfortable and you can try and sleep. Okay. It's easier to sleep sitting up. A, when you're dizzy. B, when you've got that congestion, it's easier to sleep because when you lie down, you'll be dizzy, the congestion will feel worse. Okay, but remember, do not use any more decongestants up your nose. Okay, a little bit of Old Bass is okay in the steam, but don't pop anything else up your nose now. Alright, so I'll go and get those medications put onto a prescription for you. Alright, and you can start those straight away as soon as you've got them. Alright, the Bucostem, just take that 2 times a day, okay? Once in the morning, once in the evening should be okay. Yeah, I would only take that for a few days though, and then try and see how you feel afterwards. It can make you feel very drowsy though, okay? But I'm sure you're really tired anyway, aren't you? You look tired. Oh, bless you. Okay then, antibiotics, probably going to take a couple of days to get going. Okay, but let's hope you feel better in a few days, yeah. Okay. Take care then.